Yay, we did it!
We did.
Hey guys, we're here for volume 5 of our Prairie Word Chat. We're going to give everybody a chance to join us and just kind of do a little bit of chit chat here for a second while we wait for others to join. We're super excited to be back after it feels like a million years away from
Holiday
social. We have Dr. Linsey Gold with us tonight.
break.
Hello, Linsey. Yay.
Hi, everyone.
And we'll just give a couple more minutes here before we start. And for those of you joining us who maybe haven't been here before, Prairie Word Chat is really about education and empowerment and just bringing together all of our great medical professionals and community to give some support and information and education. So
reliable information.
Yes, reliable.
Mm-hmm.
Yeah. Well, we have such a great community of people and support. And so we really want to share that with everybody because we get that here on our team every day and wanted the opportunity to share that with other people and just really give that education and empowerment. So 5:01, we're going to wait just another minute and then we'll start jumping in. Things go really fast. It's just a half an hour, but it blows by so quickly. So with your questions, if we don't get them answered, please put them in chat. We have Paula with us this evening again, behind the scenes, making sure everything's documented and make sure we get to reach out to you. So please make sure you put your questions in there. Oh, I can see she's like already put a note up for us. Thank you, Paula. Yeah. And so if we don't get to your questions, please make sure that you reach out to us. Yeah. Cool. All right. Yay. Hi, Lucy. I don't know how to do all the emojis and things like that, like the hand claps, and I'm always afraid to touch anything.
I was just going to say, I don't want to touch the screen. I don't want to touch it because what if it disappears?
I know. And please give me a filter for hot flashes. Why do they not?
Oh, that's why I got a tank top underneath.
I'm like, why do they not have a filter? Just take the
sweater off with the sweater.
Nice. So smart.
Related to that. That's horrible.
Yeah, I know. So funny. I'm waiting for that filter though. But I think all the filters are made by very young people, maybe.
Yeah, right. They don't know about how.
Great.
I used to
guys.
be one of those young people.
Yeah.
Sadly, not anymore. Okay.
Well, we call Paula our resident millennial. It keeps us all young and gets us on social and on TikTok. For those of you that don't know, we are actually on TikTok and there's some fun stuff on there. We're having a lot of fun there. Cool.
All right.
So thanks everybody for joining. We're 5:03. We'll just give it a couple more seconds really and get started. And for those of you joining us, this is our Prairie Word Chat, and we're here about education and empowerment and bringing our communities together, working with our incredible medical professionals who have so much caring and knowledge. Dr. Linsey Gold this evening. So we'll just give one more minute. I always like to start these right on the hour, but not everyone is an on-time person. So we want to make sure that we catch all of that, or maybe it's their dinner hour, so giving everybody a minute, get started. All right.
Dinner. You're by us.
I think it's 8 o'clock for you, isn't it?
Probably
yeah, that's
dinner.
bedtime.
Yeah. In my next life, bedtime. But it is kind of late to eat. I mean, you know, I don't think it's good for the system to eat that late. I do not recommend.
No, I do not either. All right.
Tammy, I would say hi. I see Tammy. I would say hi to you, like in the chat, but I don't want to touch the thing, so I'm just gonna.
We're gonna analog say hi and use our hand wave instead of the emoji. Yeah.
The old-fashioned way, you mean?
Yeah. Yes. Yeah. With my flip phone. Cool. Well, hey guys, I think we're ready to start. We're going to go ahead and roll through. Please put your questions in chat. And also, this is reposted on YouTube, Instagram, and Facebook. So if you miss the live version, we're here and it's always there as a resource, which is super awesome. So we're going to go ahead and start. Thank you, Dr. Linsey Gold, for joining us tonight on Prairie Chat. We are talking tonight about what are the benefits of exercise before, after, during treatment. And really, again, with our Prairie Chats, it's about empowerment and education and just bringing all of these great people that we have on our support team to you, our Prairie Circle community. Yeah. So with that, we can begin. And I will tell you, you guys, Dr. Linsey Gold is so awesome on social. I don't want to talk it up too much, but she's just amazing. So you want to check her out at Rest of Everything as well. Super awesome. And
who was forced to be on TikTok, but you know, it is kind of fun. I'm not going to lie.
Yeah.
Sometimes it's fun.
It is. Yeah, it totally
Once
is.
you get past the embarrassment, it's fun.
So quick introductions. My name is Holly Markwald. I'm the CEO here at Prairie Wear. And tonight, again, we have Dr. Linsey Gold and a brief introduction from you, Linsey.
Okay. I am a breast surgeon located in Michigan. I've been in practice 17 years, private practice. I've got 3 partners and we've got a really big practice. We love our patients and, you know, feel honored to be able to care for them. And just saying, big, huge fan of the bras. We have them in the office for our patients. Love, like, not to be weird, but I wear them every day. So yeah, they're great. So awesome. That's why they invited me, because I love them.
Well, I mean, it is about, yeah. Well, I have mine on too every day. Mm-hmm. Yeah. So we're going to jump right in. Our topic today is, what are the benefits of exercise before, after, during treatment?
Yeah. So, I mean, it's not news to anybody that exercise is, you know, beneficial to your health, right? Like, all-cause mortality is lower when you're active. Quality of life is better, all of that. And it goes to follow that before, during, and after treatment, it's the same. I think what happens, I mean, treatment sucks. Anybody who's done it knows that. It's sucky. A lot of times you feel like crap. I would say that low energy is, you know, fatigue is one, besides hair loss, is like the #1 complaint. And most people think, particularly with chemotherapy, oh my God, you know, this is assaulting my body, which it is. You know, I'm tired, I'm run down, I should rest, and then I'll feel better. The problem is with chemotherapy-induced fatigue, you rest and you don't feel rested, and you get up and you're not. However, numerous studies have shown over and over again that if you can, like, mentally and physically drag yourself to do some exercise, even if it's just walking 30 minutes, right? Even if it's just walking the dog an extra lap, that fatigue is lower. It's kind of counterintuitive, right? Because you would think, oh, I'm being, you know, I should rest. My body should rest, but you should be active. So sometimes it's one of the, you know, things I hear that's kind of counterintuitive, right? Mm-hmm. We know that exercise, first of all of us are more likely to die of cardiovascular disease than we are of cancer. So obviously we want to stay active so we don't get cardiovascular disease. But in general, being healthy, active, and not overweight or obese, that in itself reduces your risk for developing breast cancer, right? Okay. So there's exercise benefit there.
So that's exercise before and during, and exercise after treatment.
So sort of like mirroring the before, there's not that many modifiable risk factors for breast cancer, right? That's one of the hardest things for ladies, is the lack of ability to control everything that's happening to you. But one of the things you do have control over, of course, is your own general health, right? And exercise after treatment is reduces the risk of breast cancer recurrence, right?
Mm-hmm.
So I will say that for our postmenopausal ladies, the crowd, or women who are on treatment that we make postmenopausal because we gave them chemo or we're shutting their ovaries down.
Tamoxifen.
Yeah, exactly. So one of the things that estrogen does that's good for us is it keeps our bones strong, right? So all postmenopausal women, once your body stops receiving the estrogen, it's, your bones weaken. So the only way to, ensure or reduce the risk of fracture, I mean, other than your garden variety, vitamin D and whatnot, is actually to exercise. You have to strengthen the muscles that are around the bones, right? So they're more stable. And so, so that's a really big one. Unrelated really to treatment in general is, if I had a nickel for every time I heard somebody, tell me about gaining weight through menopause, right? I think it's little known that when you go through menopause, your basal metabolic rate, the rate at which you burn calories staring at a wall, that decreases significantly, right? So if you do the same thing you were doing, if you exercise the same way, if you eat the same way, just do your regular stuff, go through menopause, by definition, over time, you gain weight because your body stopped burning regular, calories while you sleep. So the only way to increase your basal metabolic weight is to build muscle, right? Because muscle is what burns calories. So strength, hugely important for the postmenopausal population of women. Keeps your bones strong, increases your basal metabolic rate.
And I think that's good advice for anyone.
Yeah.
So, and that's where we're going, so we started talking about treatment and oncological before and after and during. And on the same hand, what I hear time and time again is this is really good advice for all of us and wherever we're at in life. And one of the things that I think is also really interesting to kind of prepare for this is I talked to one of my forever friends who was a college athlete. She's been one of our wear testers since day one. She's been through lumpectomy, radiation, mastectomy, and also reconstruction. And so her progress before, during, and after, she's been through more than one evolution of that. And the body was in a different place each time. And so one of the things that she did say, and what you're saying, is it's counterintuitive, but staying active, getting up, moving around, helped her decrease her recovery time for her specifically. So that to me was really great information. And one of the things that I just asked her, well, what did you have any fears? What was, what were you thinking? And also each surgery is so different. Recovery is so different from each treatment. And so for her, it was really after her reconstruction, which was the latissimal dorsi flap.
Yeah.
So when she went back to swimming and her other breast hadn't been reconstructed yet, and she was trying to figure out, do you wear the form? Do you not wear the form? And was really not sure. And then the form didn't stay in her swimsuit, so she put on a Prima underneath her swimsuit with the form because she felt more comfortable like that. And I thought, it's different for everybody. And really, to me, what that said is, you do what you have to do to get out there and move, and it's going to be different for everybody.
Yeah. Yeah. She didn't let the swimsuit issue bother her, right?
No.
Yeah.
No. Yeah. But what did is it was more important to her to feel symmetrical for that moment because she was going through other things. And
of course.
So again, I think it's knowing where you're at and then having those tools or opportunities to kind of create that support for exercise, but not easy when your brain is not fully engaged, your body's not quite there, and still trying to get active.
It's hard to motivate to do anything when you're tired, especially when you're tired and you're not really feeling 100%. But so it's really kind of more of a mental right? Like if you can just like, don't press the snooze button, just get up,
Yeah.
like in the morning, right? It's that kind of thing, right? Like you in the morning, you get up and you're like, okay, when I get home, I'm taking a walk at 3 o'clock. Okay, don't like do something else in between, run an extra errand. You're doing it at 3 o'clock.
Yeah.
You're not pressing the snooze button. You're going to go. So a lot of it is just, it's hard, but it is hard, but it's mental. And so, pain is a big one that is hard for people. We tell, get out and exercise. Well, if you're in pain, it's hard to exercise, right? So for ladies who are taking the anti-estrogen therapies, right, the aromatase inhibitors, one of the side effects of those medications can be joint aches and pains, right? And so they can be really significant for some people. Again, counterintuitive, but in every study ever published, if you get out and move and exercise and stretch and maybe do Pilates and you don't have to sweat your ass off at Powerhouse, if you move, you have less joint discomfort and less side effects from the medication. Again, kind of counterintuitive, but it's another reason to continue to exercise. And you say, well, I can't do it. You can do it. And you'll have less pain afterwards.
And I think one of the questions that comes up most often, and we hear this from our Prairie Circle with our customer experience team, and also within my Forever Friend group, and it's, how do you know when it's the right time to start exercising in recovery? That's something different for everybody, but coming from a medical professional point of view, what would your answer to that be?
In the immediate post-op period, if you've had a lumpectomy, you can probably start exercising when it doesn't hurt to do so, right? Because usually what hurts after a lumpectomy, for the most part, is jiggling, right? Bouncing, thus the bra, right? So you need a really good supportive bra. And if you can put your Vita, Hugger, whatever you want to put on, your Prima.
So a good compression bra that feels comfortable,
compression bra,
that doesn't restrict, but gives you secure compression.
Fall off your shoulder in the middle of surgery, just saying,
Yeah.
Literally never, ever falls off the shoulder. Greatest thing ever. If you can put that on and it's comfortable for you to walk on the treadmill, then okay, go ahead and do so. I think you have to push yourself. Surgery's hard. The whole process is hard. So like, give yourself a few days off. I usually tell people, if you can give yourself a week off, I mean, who doesn't need a week to decompress and unwind and binge on Netflix? I don't know, whatever you want to do. Take up Sudoku. Anything, we give you permission for a week-ish to be sedentary, right? And then when you're bored and you're feeling good, you can get up and you can exercise. Now, with reconstruction, a little bit different. You can do it when the reconstructive surgeon says you can. And that tends to be a solid month. The reason being is when we reconstruct a breast, this is a little bit more implant-based, but still with your own tissues, we create a pocket there, right? And we need everything to scar into place, right? Because if you're doing all kinds of this, the skin is stretching out and like, you don't want your boobs under your armpits, right? So we really want everything to scar in place. So that's one of the reasons we restrict a lot of movement. Now, you could do a recumbent bike type of thing where you're not moving your upper body, right? You're just, wheeling your, you can do like small weight type stuff. So there are some things that you can do. I have Tammy from Studio Pilates on here, and she's got some really good exercises that you can do that are not very traumatic, and,
awesome.
You can do them in the post-op period.
And then for oncological surgery, so mastectomy, I think in terms of recovery time. And by the way, I do want to say what we always tell everyone is consult with your medical professional
Yeah.
first and foremost. Everyone's body is so different, and your med pro is going to know where your body's at and what's best for your treatment. So these are just general guidelines of where you can start to think about things. And I think whenever there's a question, talk to your medical professional. There's so many great people out there. We have one of them here with us tonight, as you all know. So I do want to put that out there. And everybody's answer is so different. When is it time for me to start exercising?
Yeah.
But one of the things that I'm hearing over and over again is that exercise is really important for overall health, regardless of where you're at in your life. So what we're here to do is figure out how to get you out there,
Yeah.
for sure.
Yeah.
So what's a common misconception that people have around exercising during recovery? What's something that you hear that I've heard some really interesting ones.
Oh, tell me, what have you heard?
Um, you know, you shouldn't sit in a chair for more than 20 minutes, and you don't want to, yeah, all kinds of, because of blood
Oh,
circulation. And we hear a lot of really interesting things.
really?
Yeah.
We like people to move after surgery, but you don't want to sit in the lazy boy and like not get up, right? But I mean, you don't have to move every 20 minutes. Think about you take an air flight, you take a plane flight somewhere,
Mm-hmm.
you don't have to pee, you're not getting up, right? So, however often you want to get
Mm-hmm.
up. Every couple hours is
Mm-hmm.
pretty good. If you're awake and you're, reading a book or doing whatever, and you pump your feet, because we're trying to prevent blood
Right.
clots, right? We're trying to prevent blood clots in the legs. It's uncommon after our surgery because we do get people up and moving so quickly. But yeah,
Mm-hmm.
that's a fine. Not every 20 minutes. I mean, you do you.
Yeah.
If you that works.
Everyone's different.
Yeah.
I think another one that I hear most commonly is the don't lift more than 5 pounds, but
Yeah.
instead of just directly post recovery, it's for a very long period of time. And that's again where we say, please consult with your PT or your medical doctor or your surgical team, whoever you need to consult with, because that is a short window of time for most people. And that's what, we always want to support activity whenever we can.
Yes. So when I see ladies post-op who are going to move on to radiation therapy, I always give them a book of exercises to start doing with their arms, the rest of the body to follow. But as if we have ladies who've been through radiation, your arm is like in this position for radiation, and radiation takes the elastic properties out of the skin. So it takes the elasticity out of the skin. So if you
Mm-hmm.
don't make sure that you've got your full range of motion before, during, and after radiation, then you're going to get pretty restricted. Like the skin isn't going to be able to stretch in order to do this, right? It's going to
Mm-hmm.
take a whole lot of work to do so. So really important range of motion exercises. Just about everybody can do those,
Mm-hmm.
after the 2-week period, right? So anybody who has drains, don't exercise with your drains in. That's a no. You
Mm-hmm.
won't want to. They're
No.
comfortable if. But once they
Yeah.
come out, you give a little time to heal, you can do it. So I think ladies are a little worried they're going to like tear something, right?
Yeah.
I can only speak to how I do surgery, but I'm pretty sure all the other surgeons out there, you're not going to tear. You couldn't do something enough that would tear something. It's just not really possible. So, so don't be afraid to move.
Mm-hmm.
You don't have to play pickleball on post-op day 2. So we need a happy medium there. But,
Right.
but you don't have to be afraid to move.
Mm-hmm.
Don't have to do that.
And I think another thing that we also hear a lot, and what we try to help people through, whether it's a hugger or something else, is good compression post-surgically, but also really long into recovery. There's 6, 8, 12 months where you still maybe have a little bit of pain here or there. And then with radiation, where your skin is changing over time, and sometimes the shape and contours of your breast change over time, you know, all of those things can really benefit from good compression, whether that's a hugger or something else.
Absolutely. You know? Your skin sort of responds and changes to radiation for an entire year after you complete it. So it's not really until 1 year post radiation, this is sort of my new baseline skin. So that's an excellent point. So for the ladies with the larger, longer breasts out there, you know, your breasts are subject to gravity like every other part of your body. So what happens when you sit in a chair all day and you got your, you know, socks on, and then you take your socks off at the end of the day? Like, God, oh my God, look at those sock marks, you know? It collects fluid, right? Your breasts are the same way. And that contributes to a lot of discomfort after surgery. So, I mean, unless you're going to carry your breasts around all the, how you feed yourself, you can't carry your breasts around. You need a really good compression bra to reduce the edema in the breast, right? That's what we got to do. So it's not uncommon for us to tell people, like at their 6-month visit or whatever, if they're complaining of breast heaviness, you know, put your surgical bra back on, you know, wear it. Yeah, because it's really helpful.
Awesome.
I mean,
I love the sock
and look good. I'm just saying.
Yeah.
Like, if you have like saggy boobs, I mean, it does keep them up.
So Linsey is a big fan of our Vita. Yeah. So I love that you love the Vita. I actually have the Vita on today. I've been wearing the Luma a little bit, but what I love about the Vita is just, it's just you can sit all day and still feel great and fantastic, and sit and get up every hour or so. But it's really that comfy, and I think
it is.
I think in terms of finding good compression and also finding a bra that works for you, it can be really difficult. And so things that we always try to educate people on, finding something that's seamless knit, that has zoned compression, so that you have coverage where you need it and relaxation where you don't, but also, you know, safe for the skin, sustainably made. Those are all things that we look for as a company, and what we're trying to educate other people to do, because we want something to be next to your skin that's safe and feels good. And everybody's body is different. So again, whether it's a hugger or something else, we're here for education first and foremost. And that sports bra with all the seams and that really rigid band, that fluid that Linsey was just talking about, that just gets trapped there. You know, there's no way for that to circulate and move out. So just keep that in mind. If it feels uncomfortable, that's because it is.
Yeah, exactly.
You know, find something else.
Right.
And that's really what we're about. And I think compression can also give you that feeling of safety and security to start moving. Even to go to the grocery store and not feel uncomfortable when you go to pick up the bag. It's under 5 pounds. Post-op.
I mean, if you don't want to carry your groceries, we're happy to say that. But if you do want to put them, feel free. Yeah.
So I think, you know, there are those things that it's just really important to know and to listen to your body, and it can really add to that security feeling. And so anything we can do to help empower movement and give people that safety and security, we're all about it, for sure. And
I'm just waiting for you guys to come out with like a bodysuit or something. Just think. Or like the equivalent of Spanx.
Oh,
not
well,
Spanx.
I mean,
like
we love Spanx.
Like,
I love what they've done with the red backpack, and I just love what they're doing there.
I feel like they have great leggings. I mean, if you're thinking,
you guys heard it here. But we'll stay with bras for now. But I will say that what is true is we are about helping people feel better. That's number one, what we're about. And this is part of that. So our half an hour, again, it's so crazy. It goes so fast.
I know.
And that is the cutest shirt. For those of you that don't know me, I love hearts. There's hearts
yeah.
all over. Yeah.
Mm-hmm.
So what a great way to bring that into our chat today. So
I love you all.
I know. Here's two people that our minds are going in a million directions here for half an hour. I'm so sorry, guys. But I want to just summarize really quick kind of where we got to, which is what I heard tonight is movement is really important. Activity is important. Pre-treatment, during treatment, after treatment, movement makes a difference. So what I heard is to do what you need to do to get that movement going, and everyone's movement level is going to be different. Talk to your medical professional if you have questions, and really good compression can help you feel more safe and secure to get moving. So we're a resource here if you have any questions. I know that the Breast of Everything has awesome resources. Yeah. And the Breast of Everything is really the Breast of Everything. So they just had this really great post on, I think it's 8 different breastfeeding positions. And I love, there's a video on a diagnostic versus
screening,
preventative screening mammogram. And, you know, there's really great information there for anyone and everyone. So just so you know, great education there for those folks that are joining. And that's it. That's our Prairie chat. That went so fast.
I know. Well, thank you so much for having me. Super fun.
Thank you. Really appreciate your time. And again, guys, we'll repost this. So if there's any questions, let us know. And thank you so much.
Okay.
Bye, guys.
Bye.